this. Okay. Welcome to part 2, chapter 14. Let's start with our study tip. So, research shows when you change your answer on a multiple choice exam, you typically end up changing it from a correct to a wrong. So that's why they say, the saying says, always go with your gut or stick with your gut, right? So the only time you ever want to change an answer is when you realize that you didn't fully read the question, so you didn't actually know what it was asking. Okay, all right. So part 2. The equation flow is equal to pressure divided by resistance. Okay, so pressure and resistance will have opposite effects on flow. Okay, you're going to practice this with PhysioX. So the sympathetic nervous system is always going to be giving, it's always stimulated, and it's always going to be talking to your vessels. And so we can say that it's always on, and that provides vascular tone. Vascular tone refers to the stimulation of the smooth muscles to contract, so that you are maintaining some, always having some muscle contraction on the vessel, and that's how you control the diameter of the vessel. And you're basically in a state of readiness to become larger or smaller. So if you increase the stimulation from the central nervous system, sympathetic nervous system. If you increase the sympathetic nervous system, it will contract more, those smooth muscle contractions, and so you vasoconstrict the vessel. Okay, and of course that's going to increase your resistance, and that will decrease your flow. Okay, if you decrease the amount of stimulation from the sympathetic nervous system, then that's going to allow those smooth muscles to relax some, and that will cause the vessel to dilate, open up. And it's going to be very specific, right? There's going to be lots of fibers, and you'll be talking to very specific areas of the body. So you can dilate certain muscles more than other muscles, right? The muscles that you're using at the moment. You don't, when you're running, you don't need to be giving a whole bunch of extra blood to your arms, right? They're not doing very much work. Your legs are doing the work, okay? At the same time, if you're running, you don't need to be sending extra blood to your gastrointestinal tract. That's when you're at rest, right? So things like the GI, the kidneys, and the skin might not need as much blood flow. Of course, the skin is tricky because if you get hot, if your body temperature rises, then you do send more blood flow to the skin to cool off. Okay. So when you are at rest, the parasympathetic nervous system will be active, and that will vasodilate the GI tract. So parasympathetic vasodilates only the GI tract. You can't use the parasympathetic nervous system to vasodilate other parts of the body. So how do you vasodilate other parts of the body? By simply inhibiting sympathetic nervous system, right? Decrease sympathetic nervous system to vasodilate, okay? Intrinsic control of blood flow. Nearby tissues have metabolic changes that can alter the flow. Based on the current conditions, they get information and decide what needs to be done right there immediately. Okay, so this includes monitoring oxygen levels. So when you're exercising, you're using oxygen much more rapidly. And so that will be sensed, and that will cause some vasodilation to happen. Same thing when you're at rest, you're going to sense that you have plenty of oxygen. You don't need as much, and this will cause your vessels to vasoconstrict. Endothelial cells in the area of the arterioles will also detect what's going on, and they can release hormones to regulate vasoconstriction or dilation. Histamines are released from white blood cells, leukocytes, white blood cells. And typically this is when the white blood cells encounter a pathogen. And so they release histamines to recruit more blood flow, which will also help recruit more white blood cells to the area to take care of the problem. However, as you might know, allergies are when the immune system, those white blood cells, incorrectly think that a pollen, dust, dander, whatever, something that's not a pathogen, but they think it is a pathogen, so they release all these histamines unnecessarily, right? So it's an error. So you might be familiar with histamines for sneezing, watery eyes, etc. Okay, but usually it's a really good defense mechanism. Okay. You can also change the amount of constriction or dilation based on hot or cold, right? So when you stick your hands in warm water, you're going to open up, you're going to vasodilate. But when you jump into a really cold swimming pool, it's going to vasoconstrict. And that makes sense because when you have an injury and you have swelling, what do they always say to do? Ice and elevate, right? Ice helps vasoconstrict and helps get that inflammation down. Turns out ice can also have some direct effects on pain, and that would be, even though we're not on the neurology section anymore, you could definitely look into hot or cold compresses and try to dig into some of the physiology of what's happening for your discussions. All right, so remember, you only have 5 liters of blood circulating through your body each minute at rest. And so it makes sense that we have so many different control mechanisms to make sure that the parts of the body that need blood get it, and parts that don't need it don't get as much, okay? Now we will continue that talk, rest versus exercise, okay? So the heart will need more blood when you start exercising, right? You have the left and the right coronary arteries that supply blood to the heart itself, the tissue, to keep it alive. So extrinsic control would be the sympathetic nervous system, and can be stimulated and stimulate vessels to dilate, open up. So you are suddenly faced with an emergency, a stressor, right? You need to fight or flee. And so that's going to be a big stimulation from the sympathetic nervous system, which is going to vasodilate those vessels and make sure you're ready for action. Intrinsic control, like we've been talking about, will detect the amount of carbon dioxide. If it's too much, it's going to vasodilate. If oxygen's low, it's going to vasodilate. If waste is building up, it's going to vasodilate. Skeletal muscle will have the same extrinsic and intrinsic control mechanisms. You're going to have the biggest, about 80 to 85% of the blood during exercise is going to go to skeletal muscle. And that actually is 20 to 21.25 liters. So 21 to almost 20 to almost 21.5 liters of blood are going to the muscles during heavy exercise. At rest, it's only up to 1 liter. So a huge, huge difference. The heart does also have a pretty big increase from, 0.2 to a fourth of a liter at rest for the heart. And that increases to 1 liter to 1.25 liters during exercise. So a huge increase to the heart, but the vast majority of the blood is going to the skeletal muscle. And so you need to look at this figure, and you need to notice that the top part represents 25 liters per minute of blood, okay, during heavy exercise. And the bottom part of the figure represents at rest, which is only 5 liters. You see right here, 5 liters. Okay, so all of these percentages don't really mean anything if you don't calculate it out. So that's some little homework that you should do when you study, is actually do the math. What is 3% of 25? And do that for each of these values so that you can actually compare rest to exercise. I'm not going to test you on a specific number, but I do want you to know the trends of, the muscles get the most blood during exercise. The heart would be the next, but you do also get a small increase in the brain, very small. You also get an increase for skin, which it doesn't look like it in this image, but you could circle that and say you do have an increase, right? At rest, this tiny dot represents about 0.2 to 0.25 liters, and during exercise that increases all the way to 1 liter, maximum 1.25 liters. So that's like quadruple at the low end. So 4 to 5 times more blood to the skin during exercise. So you would expect that image to be up here. So I don't think that this is the best visual. I already didn't like how they showed percentages. So I want you to fix this diagram. I want you to circle, like the skin, and maybe draw something over here to point out that the skin actually does get a significant increase in blood, right? So go through, calculate everything for heavy exercise and rest, and then state, big increase or small increase, or big decrease, small decrease, okay? Now, when you look at the GI tract, you do have the option during heavy exercise to reduce blood flow a little bit, but not that much. Not as much as we're led to believe. We're always told, rest and digest. At rest, the most blood that you would send to the GI tract would be 1.25 liters, and the least would be 1. So at rest, you have at least 1 liter up to 1.25 liters. But during exercise, the decrease is only 0.75, and that's the same maximum of up to 1.25 liters. So during exercise, you can decrease 1/4 of a liter, and that's it. Okay, so it's not a huge difference. So I would say for the GI tract, you get a small decrease in blood flow during heavy exercise. Okay. All right, I trust that you can go through the rest of these and compare them, but let's go ahead and talk about the skin a little bit more. Okay, sorry for that. So Normally, you have some blood flowing into your artery, through your artery. It goes up into the capillary loop, and then you know about the processes of the blood flow out into the interstitial fluid. Tissues absorb what they're going to absorb, and then the veins will take the used deoxygenated blood, and then that will go into what looks like blue in this picture, into the veins, and then go back to the heart. But you also have these connections here called anastomosis or anastomoses when we say plural. And this can help you decide how much blood you want to actually send into the capillary loop. So perhaps you're experiencing a drop in body temperature. Maybe it's very cold outside and you don't want to send as much blood to the epidermis because it cools off your blood and you want to maintain your body heat. So you would use some of these anastomoses to bypass, not completely, you got to keep the tissue alive, but you will restrict quite a bit of blood. Okay, so in addition to vasoconstriction, you can also just divert some of the blood and keep it for yourself, just straight from the artery back into the vein. I know, seems weird, right? Okay, so let's write that out. Skin changes will depend on the body temperature, right? Deep body temperature, right? Because our homeostasis, most importantly, we need to maintain our vital organs, right? So we're going to maintain our deep body temperature. Why is temperature important to maintain? Why do we have to keep it warm? Because of optimal temperature of enzymes. Enzymes are doing all of the chemical reactions in the body that keep you alive. Okay. Vasodilate when you're hot, so you can send more blood to the skin and cool it off. And vasoconstrict when it's cold, so you keep it more blood internal and warm. And then additionally, right, the anastomosis is singular. I should really change that to anastomoses. Can also be used to bypass capillary beds. And again, remember, you're not going to completely stop the blood flow to your hands and feet, the surface of your skin, but you will reduce it. And you already know this because you know when you're cold, your hands and feet are cold. Okay. Sweat glands also play a role in releasing the hormone bradykinin, and that will cause a vasodilation, which makes sense. When your sweat glands are activated, you're sweating so that you can cool off. So it makes sense that they would also encourage vasodilation. Okay, now the brain doesn't change much, and that makes sense because our brain always needs to function and keep us alive, right? So we do keep that pretty regular, 750 mils per minute. When you exercise, you can increase this a little bit, and sometimes other conditions will also cause an increase. So you do have some extrinsic control by the sympathetic nervous system, but you're not doing that very often and not very much. So the most you can ever send to the brain would be 1 liter. Okay. So when you exercise, you can get a little extra blood flow to the brain, but not too much. Okay. You're mostly using intrinsic control so that you're getting exactly what the brain needs, minute by minute. Okay. So this is a good diagram or picture to help you get a visual of vasoconstriction. Okay, so smooth muscle would be responsible for constriction. So you could label this clamp and say smooth muscle, right? So at the very spot where the constriction happens, there's a lot of pressure and very reduced flow. And that's backwards from the rest of it. So you need to really make sure you know which portion you're talking about. Are you talking about before the constriction, at the constriction or after, and that will help you know the relationship between pressure and flow. Okay, so at the site of constriction, pressure is high, flow is low, resistance is high. Okay, here, right before the site of constriction, you have increased pressure because the blood is building up. It's not able to flow as quickly. So you get a buildup and you get a pressure, but you got a decreased flow, right? You just can't get through as much. On the other side, you're going to have less pressure because now you have less blood flow, right? All right, so study this, label it, read the caption in the textbook. Okay. The effect of vasoconstriction, as we were just talking about, is an increased pressure at the site of constriction. You have increased pressure at the region right before constriction as well. You got the buildup, and then decreased pressure at the after the constriction. Okay, this is another image you want to really study and understand the relationship as you move away from the heart, aorta, arteries and arterioles and capillaries. You get more and more vessel, and that means you have more and more surface area of vessels. And as surface area of your vessels increase, your pressure drops, right? And it continues to drop as it goes through back to the heart into the veins. And remember, veins, they don't have a heart. They don't have anything pumping to give pressure, okay? So this blood pressure and cross-sectional area of vessels, right? So the area, the size, so as you get smaller vessels, you have more of them, right? And more surface area. And that higher surface area gives you the least pressure, right? From the heart, high pressure, all the way down, okay? More blood touching the walls of the vessels, right? There's more vessel wall for blood to touch as you get smaller. And so that creates more resistance, and that's why you will also have a decrease in flow, okay? So this one's not showing you flow directly. All right, controlling blood pressure. As I just said, increased surface area in the capillaries. There's more, they're tiny, but there's lots of them. So it's increased surface area. And that's going to increase resistance because you have more blood touching the vessels. And so that's going to give you a decreased flow. It just so happens you also have a decreased pressure because you're farthest from the heart. Directly related to vasoconstriction or vasodilation. Okay, so the amount of resistance can go up if you constrict or go down if you dilate. And it says to see the figure for reference, and it's talking about this figure here, but this figure is not showing you vasoconstriction or vasodilation. So really, that comment should have been with this bullet point, right? So C figure is more for the first one. Okay. And then it's telling you from looking at that figure, now take it a step further and relate it and think about vasoconstriction and vasodilation. Okay, pressure falls as you move away from the heart. Mean arterial pressure is the pressure in all of your peripheral, everything for blood flowing away from the heart, arterial, right? So you take your cardiac output and then you multiply that by all of the peripheral resistance. And that is your mean arterial pressure. Okay, so there is an animation in your book, and I believe, yes, here you have a link. You can copy paste this link into your web browser and watch the animation that goes with this figure and step by step. Okay, so you have these baroreceptors in the carotid sinus and in the aorta. Okay, and when blood pressure increases, these tissues are going to be stretched, and that stretch is going to trigger these baroreceptors to fire action potentials more quickly. So they're always firing action potentials and telling the medulla oblongata what the blood pressure is. Okay, so you have a normal rate of action potentials, which is how you know that you have a normal blood pressure. And when blood pressure increases, you will set off more quickly. You'll have a faster rate of action potentials, and that's going to signal the medulla oblongata that blood pressure is too high and we need to get it back into normal range. And so it's going to respond in two ways. It's going to increase stimulation to the parasympathetic nervous system. So you see that here, which is going to make it harder to reach threshold, and that's going to give you less action potentials for the heart, and that's how you slow down the heart rate, right? Remember that? If you don't remember it, go review it. Okay, so parasympathetic is stimulated to slow down the heart rate, and then the sympathetic in red here is going to be, the stimulation is going to be reduced. So a decrease in sympathetic stimulation, which also decreases the heart rate, but it also will decrease the stroke volume. And the third action is going to be to vasodilate. So it's not shown here in this image, but the decreased sympathetic stimulation will also vasodilate vessels in the body to reduce resistance and increase flow. So you can reduce your heart rate and still have enough flow, right? So you're going to reduce your blood pressure, okay? So that's written out here for you. And I know this slide and the next slide, I edited them after posting to Canvas. So it's going to look different. It's the same information. Like what is originally on your slide is not wrong, so don't panic. But you might want to also write it down the way I have it now, because it's organized differently. I think it's organized a little more effectively to help you. So rearranging information is always part of studying, which I've encouraged from day one. And so now you get to see it in action. You can compare the two. Okay, so blood pressure. It's monitored by baroreceptors. Where are those located? They're located in the carotid sinus and in the aortic arch. If blood pressure gets too high, the baroreceptors will increase the rate of action potentials to the cardiac center located in the medulla oblongata, the brain stem. In response, the medulla oblongata is going to stimulate the parasympathetic nervous system, and that will reduce your heart rate. Okay, so parasympathetic nervous system stimulation will be increased. So in this first blank, you're going to say increase stimulation to parasympathetic nervous system, increase, and then you're going to, for the heart rate, you're going to decrease. So actually, I wonder if I can actually write on this. So you're going to increase, beautiful, and you're going to decrease. Yay! Okay, the sympathetic nervous system stimulation needs to be decreased, and that will decrease your heart rate. got a little off, but you know that's a down arrow. Okay, whoa, now things are getting way out of hand here. I don't know how to delete with this either. Oh, eraser. Whoa, nice. Okay. So let's make a little bit better arrow. I'll try to be careful. There we go. And then vasodilation is a special, right? So stroke volume and vasodilation also get controlled by the sympathetic nervous system. So that's unique, different from parasympathetic, right? The only thing the parasympathetic nervous system stimulation is doing is heart rate, right? So when you increase parasympathetic stimulation, you decrease the heart rate. But when you decrease sympathetic nervous system, you're going to decrease the heart rate, you're going to decrease the stroke volume, and you're going to vasodilate vessels in the body. Okay, good. You also have a hormone, which is not on this slide, okay? But you do have a hormone, atrial natriuretic factor, sometimes called atrial natriuretic peptide. It's a hormone, and it's used to decrease blood pressure as well. Okay, so what if you need to increase? Your blood pressure has dropped and you need to get it back up. So you're going to increase the sympathetic nervous system stimulation. This will also cause vasoconstriction, right? Okay, I should stop playing with this pen. Okay. It's also going to cause your heart rate to increase. Okay. At the same time, if you're increasing sympathetic stimulation, then you're going to decrease parasympathetic because they are in opposition to each other. So to make it easier for the sympathetic nervous system to do its job, you've got to decrease the parasympathetic. Okay. And then you have several hormones to increase blood pressure, right? Antidiuretic hormone, which you learned is produced by the hypothalamus, stored in the posterior pituitary. You have aldosterone, which you've started to learn about. Comes from the adrenal glands, but you have a system of regulation, which we'll talk about when we get to our urinary chapter. And the same goes for angiotensin 2. So angiotensin 2 is very interesting. There's a pathway you're going to learn when we talk about urinary. It is a systemic, so the whole body, vasoconstrictor, but it also tells the adrenal gland to release aldosterone, which will play a role in the kidneys to increase blood pressure. Okay, so very interesting interaction here. Angiotensin 2 has two functions. It directly vasoconstricts systemically, but it also causes the release of aldosterone, which will have a different mode of action to increase blood pressure. All right, hope you're looking forward to the urinary chapter. It's kind of fun. All these chapters are fun though. Okay, Garrett, he's crazy and has gone into below zero temperature for fun. Who does that? He hasn't urinated in a day. The fire department finds him unconscious in the snow, dying. Okay, they wrap him in a blanket and give him a shot of adrenaline, which you know we should be using the word epinephrine. All right, so answer these questions. Pause the video. Why did they wrap him with a blanket? Why did they give him epinephrine? Was he vasodilating or vasoconstricting before they gave him adrenaline? And which the sympathetic or the parasympathetic nervous system was in charge of his blood flow before he was rescued. All right, pause the video. Okay, so of course they wrap him in a blanket to help warm him up. Everyone got that. Okay, epinephrine, what's that going to do? It's going to speed up your heart rate, get your blood flowing. 3, he has been vasoconstricting, right? Part of the reason he wasn't urinating. Vasoconstricting, trying to limit the amount of blood flow to the extremities, keep it for his vital organs to keep him alive. Not urinating has to do with trying to keep all of the water in the body and keep the blood pressure up and keep warm, okay? And he was under tremendous stress. His body is now trying to survive. And so he's stressed, he's cold, he's at risk of dying. So his sympathetic nervous system, of course, is in control, is regulating his blood flow to reduce his blood flow before he was rescued. But he was rescued. Okay. Happy ending. Now, taking someone's blood pressure, measuring blood pressure. You use a sphygmomanometer, and that will have a cuff. It has tubes. One tube has a little puffy, I don't know what the term is for this, but you pump it like a little pump. You pump it with your hand, and that puts air into the cuff. And as you fill that cuff up with air, it collapses, right? It's squeezing the muscle and it's collapsing the artery. And this artery is the brachial artery, okay? And the other tube is going to have a gauge on it, which is going to tell you pressure, and that's in millimeters of mercury, okay? And so typically you can fill up the pressure in the cuff to about 140, unless someone has really high blood pressure, you would have to go higher, but that would be very high. Okay, that'd be very scary. Okay, so you fill it up, and it's squeezing and collapsing the brachial artery. So now you've cut off the blood flow, and there's no blood flowing in this artery. And so when you listen to it, so in addition to this cuff and the gauge and the pump, you also have a stethoscope, which you place around here, and you're listening for sound, okay? And so when you collapse this, there's going to be no sound. So that's another way you might have wondered, like, how do you know how high to pump it up? So you pump it up to 140, you listen. If you hear, if you don't hear anything, then you've collapsed, right? And if you do hear some noise, then you've probably only collapsed it partially, and you would know that you need to fill it up higher. Okay, so we've successfully filled it up. We've cut off the blood flow. Now we will slowly release the pressure in the cuff to let a little bit of blood flow through. And so the very first sounds you hear is due to just a little squirt of blood, and that bounces all around the vessel, and that creates sound called Korsakoff sound. And the first sounds means that you have reached your systolic blood pressure. So whatever the pressure of the cuff is your systolic blood pressure. And so we've used 120 because that's the average healthy blood pressure. You continue to slowly release that pressure in the cuff, and you're going to continue to have those Korsakoff sounds at every systole, okay, until you reduce the pressure enough to open up the vessel once again and let blood flow freely, and that is called laminar flow, okay? And that you're not going to hear. So as soon as you stop hearing the Korsakoff sounds, that is your diastolic blood pressure, and the average healthy Number for that is 80, so that's what we've used. So 120 over 80. 120 is the first sound. 80, you could say, is the last sound, or as soon as you stop hearing sound. Okay? This is another way to look at what we just talked about. No flow, because the cuff pressure is so high, you collapsed that artery and it's now silent. As you release pressure in the cuff, you let a little bit of blood out and you're going to hear that first sound. Now you know your heart is beating the whole time, right? So you're going to have, right during the contraction of that ventricle, you get your systole, and then the pressure drops to not 0, but to 80, okay? That's diastole. And then again, right? So boom, 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 boom. Okay, and as you continue to release the pressure in the cuff, you keep hearing these sounds, the corticoff sounds, until you've restored laminar flow, and then it's silent again, right? So systole, diastole. Systolic blood pressure, diastolic blood pressure. Okay, measuring blood pressure summary. The first sound you hear is due to turbulent flow, and that is your systolic pressure. The sound will disappear when laminar flow is restored because you've released the pressure in the cuff, and that's your diastolic pressure. Typically, it's 120 over 80. Pulse pressure is when you subtract the diastolic from the systolic pressure. And mean arterial pressure is taking the diastolic and adding 1/3 of your pulse pressure. Memorize these, practice using them, they will be on your test. How do you lower your MAP? Right, so MAP, mean arterial pressure, is how hard your heart has to work to push, it has to push against this mean arterial pressure in order to get blood flow. So you want to lower your MAP so it's easier and your heart doesn't have to work as hard. So how do you do this? You do things like weight management, exercise, very important, right? Lower your stress levels, lower your sodium intake, right? All the things you do to lower blood pressure. So hypotension, I put an arrow here to help you remember and emphasized the PO. Hypo means too low, hypo, low. Okay, so low, hypo, low. Okay, so you have below average blood pressure. It's lower than it should be. Okay, so if your systolic is less than 100, that is too low. It's pretty common. The older you get, you are likely to have trouble with low blood pressure. So orthostatic hypertension is common in older people. And it's also common for patients after surgery. What happens when you have low blood pressure? You can feel dizzy, you might even faint, okay? This can also affect cognition, especially in the elderly. So low blood pressure is especially problematic for elderly, putting them at risk of falling, breaking bones, hip, right? That's very, very dangerous. But also the cognition, okay? So dementia is already an issue for a lot of elderly individuals. Low blood pressure can make that worse. Okay, hypertension, arrows going up, it's too high. Blood pressure is higher than normal. So anything 140 or above is high pressure. Diet, obesity, age, race, heredity, stress, smoking, these can all increase your blood pressure. You can't do anything about your heredity, right? You cannot change your DNA, but you can know your medical history for your family and be proactive, right? So if you have inherited high blood pressure, don't wait for your blood pressure to be 140 or higher. Keep it low, be proactive. So I think the next, why is it so important? Because all that pressure against the vessel walls will lead to damage. And if you damage it, you could have stroke, you can build up plaques and have atherosclerosis, which puts even more pressure on your heart. High blood pressure, you're working your heart very hard, and that can lead to heart problems, right? And also make you more likely to have stroke. Okay, so what can people do to lower their blood pressure, keep it healthy? Reduce salt, watch your diet, have a healthy diet, watch your weight. If you become overweight, lose the weight. So with that, you want to also exercise. Exercise helps manage your weight, it helps manage your stress. It has a lot of different physiological functions when you're exercising that help encourage all sorts of health, and not just your blood pressure, right? Okay, age you can't do anything about. Your race, you're not going to change that either. So really you have to target diet, your weight, your stress level, and or how you cope with stress rather, and smoking. No one needs to smoke, so don't smoke. Quit if you've already started smoking. Nicotine is bad for you in all forms, so we really shouldn't say smoking. It's just the most common, but anything that you're doing to get nicotine is going to put more strain on your heart. It's going to increase your blood pressure, so don't do it. Okay, so what can you do to lower blood pressure? You can manage your weight, have a good diet, lower your sodium, exercise, stress management, and stop using nicotine. Okay. Another thing when we're talking about high blood pressure, for some women during pregnancy, their blood pressure gets too high and it's dangerous. Okay, all women will have an increased blood pressure from their normal. You're going to have extra blood so that you can feed the baby, and that's going to give you a little bit higher blood pressure. But if it gets dangerously high, then you're at risk of stroke, convulsions, and all sorts of problems. And so that, once it's too high, is called preeclampsia. And usually they'll induce labor if the mother becomes if her blood pressure gets so high that it's considered preeclampsia. That's, if possible, that's usually what they'll do. If it's too early to induce labor, they might put her on bed rest. There's not a lot, I don't think, there's not a lot that they can do to lower the blood pressure other than trying to, like I said, bed rest, just trying to really lower the mother's activity and stress. Okay. Circulatory shock. All types of shock mean that you don't have enough blood flow. Okay. It can be due to a loss of blood. So hypo, O for too low, volemic for volume. So hypovolemic shock, you've had a loss of blood, you have low blood volume. You could have a bacterial infection, and you'll learn more about this when you take microbiology, but it can lead to septic shock from overstimulation of the immune system, which changes your blood flow. Allergic reactions can happen, and you can have anaphylactic shock. Central nervous system damage, so like if you're in an accident, you can have neurogenic shock, and heart failure, of course, would also change blood flow, and that would be cardiogenic shock. People die of septic shock all the time in hospitals. It's a huge problem, so make sure you really pay attention to your microbiology. Okay, as healthcare providers, you need to be very careful to try to prevent infection, because they are so common, and they are the not the reason that the patient came into the hospital, but a lot of times it's the reason that they don't get to leave the hospital. Okay, a lot of people die from this. So like I said, all of these types of shock mean you're not getting enough blood flow to the vital organs, and if that persists, that can cause tissue death. If it's extreme enough, then it'll just outright kill you, right? You have to have blood flow to the brain, to the heart. So go ahead and you can research any one of these and teach us more about it. Okay, that's the end. Good job.